Movantik tablets are a prescription medication used to treat opioid-induced constipation in adults with chronic non-cancer pain. It helps to relieve constipation caused by opioid pain medications without reducing their pain-relieving effect. Movantik tablets contain naloxegol as active substance. Naloxegol is an opioid receptor antagonist that works by blocking the effects of opioid in the gastrointestinal tract, specifically in the bowels. How to use. Take Movantik tablets orally with or without food. The usual dosage is 125 mg tablet taken once daily. Movantik should be taken at least 1 hour before or 2 hours after the ingestion or any other oral medications. Contraindications. Don't use Movantik tablets if you are allergic to naloxegol or any ingredients in the product. Avoid Movantik tablets if you have a known or suspected gastrointestinal obstruction. Special instructions. Don't take Movantik if you have a history of opiate withdrawal or are currently experiencing opiate withdrawal symptoms. Inform a healthcare professional about all medications you are currently taking, as Movantik may interact with certain medications. Side effects. Common side effects of Movantik may include abdominal pain, diarrhea, nausea, and flatulence. Rare but serious side effects may include severe diarrhea, dehydration, and gastrointestinal perforation. If you experience severe or persistent diarrhea or any other unusual side effects, contact a healthcare professional.